My name is Sarah West. I'm a palliative care physician and a hospice physician with Riverside Health System. I've been with Riverside for almost 14 years. I took a year off last year to go to VCU for a Hospice and Palliative Care fellowship and have just come back to do that work. So I do both hospice and palliative care, and everybody wants to know the difference between those two things. So hospice is a Medicare benefit that you have to enroll in that comes with some help at home as far as some nurses coming to visit, sometimes an aide and a social worker. Palliative care is holistic care looking at a whole patient, a family, and that kind of thing, particularly for advanced and serious diagnoses, and to talk about, what matters if time is limited. And so I do hospice work as a hospice medical director to help with patients who have enrolled in hospice. I do a lot of patient care for patients who have not yet enrolled in hospice but are facing serious illness. As a hospice and palliative care doctor, I have a really varied schedule. In the mornings, I get on the phone with my hospice nurses and talk about any events overnight, and we may do some prescription management and also talk about some symptoms or some family issues where families may need a little bit of extra support and encouragement. About mid-morning, I head to the intensive care unit at Walter Reed Hospital in Gloucester, and I round with the ICU team. In the afternoon, I generally head out to patients that are homebound, who are unable to get into a clinic or into a doctor's office, and see them at home. It's been incredibly eye-opening to see how a lot of our friends and neighbors live, and also to see them at home is particularly enlightening because you get a real sense of what their day-to-day life is like, and it's so different from the way we see them in clinic. Generally, those conversations are about their illness, how things are going, are they able to get themselves to the bathroom, who's cooking their meals. It's a lot of very practical details, but those are the things that really matter in my line of work, to find out exactly how we can help meet patients' needs at their home.